It's a great privilege to be here amongst so many important mothers and ladies, and I'd like to say a big thank you to the organisers of this, Leigh, for putting on this important meeting. We're here to learn, and my contribution is somewhat second-hand compared to what we've just heard. But I did do some research when I, as you do, an MA in retirement, when you're getting a bit bored. And I decided that it would be really interesting to find out more about the consequences of these anal sphincter injuries in mothers. I'd spent my professional life sewing them up as a surgeon. I had no idea that the impact that they had on women's lives and in their family lives, and I'd like to share some of that with you. As a consequence of this research, I felt that we should really set up a charity to support these mothers, and I want to share a little bit about that. And our launch meeting was to have a one-day educational event at the Royal Society of Medicine on the 22nd of March 2017. So we've been going about 15 months, and it's been a very interesting and exciting journey. Now, just to start with, if you read the literature and you Google anal incontinence, you'll get one definition, and if you Google fecal incontinence, you'll get another. And the problem is that anal incontinence after having a baby is actually very common, but frank fecal incontinence is much less common. And the data has been badly skewed because of this definition issue. Now, we've heard a good deal about consent. And we know the risks of these injuries, and they are primarily in mothers having their first vaginal birth and in mothers requiring an instrumental delivery, and forceps is associated with much more damage than ventouse. There are other factors. We've heard about shoulder dystocia. Very interestingly, there's an ethnicity risk factor too. And it's very, very important that we understand that we're not just a group of middle-class, well-educated people, that we are living in a world with a huge social change and divide. And we need to try and address in our support all sectors of our society. So what were our aims as a new charity? And they were, number one, to support mothers. Number two, to improve public awareness. Nobody has any idea about this because nobody will talk about it. To research better ways of primary prevention. OAC Care Bundle is absolutely instrumental in this. Better detection. We need to educate the profession. We've heard a lot about doctors who don't listen. And, doctors don't know either. If you ask general practitioners about these injuries, they haven't a clue. And midwives. Once the babies come, that's all they're interested in. Mum gets abandoned. We've heard that. And then we need to talk with people who are involved with healthcare policies because these mothers need support. We need to have a clear pathway of help. So that's what we're up to. I have a database now of about 140 of these mothers, and here's the information on the first 81. 68 was their first baby. 70 of the 81 assisted birth. Anatomical injury in all except one. Neuropathy. Jenny mentioned neuropathy. 23 of these 81 mothers had a neuropathy. And look at this. 54% incorrect assessment of the injury. And 24 sustained a fistula. Some people hear about fistulas in Africa, and they hear about fistula hospitals in Africa. Fistulas occur here, and nobody talks about it. So, I've already pointed out that missed tears is common. Postnatal depression. 60% of mothers that I talked to suffered bad depression. Many were on medication. 37% post-traumatic stress disorder. Real marital distress in the majority. Failed relationships. And then this business of not being able to go back to work. Jenny's told you her story. I've heard too many stories of highly educated, committed mothers who haven't been able to go back to work, and there's no educational support for them. So here's some data. This is a survey undertaken in Australia. They looked at the incidence of impaired continence in mothers having their first baby 12 months later. 36.6% couldn't control wind. You know, some insensitive doctors will say, oh, so what? Oh no, for a young person with a young baby, that's a huge problem. 21% had to dash to the toilet, and many of them there in time. And frank fecal incontinence, fortunately, a little less common. But over 36% with real impairment of control. And does it stop? No. Here's a survey 12 years after delivery, and average age of the mother by this stage was 43. Fecal incontinence, that's proper incontinence, was 15%. So lack of control of wind and having to dash to the toilet, the things are not included in that definition, far higher. So I'm afraid once these injuries occur, symptoms go on forever. They probably get worse around the time of the menopause. This cartoon is deliberate to remind people that we live in a multi-ethnic society, and for some, in different aspects of our society, find it much more difficult and have even greater problems. They can't talk to their husband. In fact, if they did, they would be left alone. But the one thing that mothers tell us is, you know, I have to hide my condition. I have to keep it a secret. Best not to talk about it. They feel constantly unclean. They become obsessed about washing, quite understandably. We've heard about the psychosexual morbidity. It's absolutely horrendous. You know, he is hardly a husband anymore, more like a carer. I go to bed early in order to avoid it. And these mothers feel hugely isolated. They feel confined to their home, afraid to go out of the house. And of course, they're embarrassed, particularly if they can't control gas. There's a loss of confidence. I've talked about employment issues, and they find it really, really isolating because there's no one to talk to. They can't even talk to people within their own families. And during this piece of research, we generated this MASIC word picture. In black is the condition. The size of the lettering indicates the power of the statement. The green is methods of coping, and the red are the things that keep mums going. Hiding my condition, unclean, sexual horrors, isolation, anxiety are the key words. And they cope by washing, by having to plan the day. Jenny's told us about that. And they keep going because of their baby. So we set up a website. We don't have a webmaster. We have somebody who's very kindly, as a volunteer, helped to put things on for us. We've had a number of focus groups. We had a focus group at the international meeting of incontinence held in the Midlands last month, and here are some of the things that the mothers said at that get-together. And no help for the partner. I think I want to identify that. Why are we not warned? They're terrified that the caesarean section rate will go sky high. Are these good reasons for uninforming mothers of risks? Now, we can't, as a little charity, just started, attempt to make any impact at all on our own. And so we have worked very closely, and are continuing to do so, with our royal colleges, and also with mothers' groups. They're terribly important. Birthrights are here today, just great. They really understand some of the issues that these mothers face. Birth Trauma Association, Mumsnet, OAC Care Bundle. Really, really important. And we work together. Postnatal depression is now recognised in this country. We have a 13% prevalence, and we have some national support now. We've got funding for advice and assessment. But we have no funding or support for a much more common but unspoken taboo of mothers with anal sphincter injuries in childbirth. At least 30%. We make this proposal, and I'm going to just read it to you. If you, this is a mother, this is what we feel they should be told when they're pregnant, for the first time. If you should suffer a lack of control, go and see a medical doctor and ask to be referred to A, B, and C. Because at the moment, they have no idea where to go, and they don't even know about it, so they're too scared to talk about it to their GP, and therefore they get referred to the wrong place. We've tried to be quite active. We've been involved with all these various meetings last year and this year, and we continue to do so. Great to be invited to meetings like this and to share some of this with other people. We've got a public awareness programme, and we've had discussions with the Welsh Assembly. In Wales, these mothers are denied the same treatment that mothers in England can get. Is that right? In Scotland, much the same. It's an expensive piece of equipment. Jenny's talked about it because she's had it. It's called sacral nerve stimulation. It's £15,000 worth of kit. And in Scotland, you can't get it. In Wales, you can't get it. We've had discussions with members of the House of Lords, and we had a really good meeting last month with a group of mothers with parliamentarians. And we hope they are beginning to listen. And we have future plans of education days. We feel that's really, really important, not just educating the profession, but getting the mothers together. And we've got local mother support groups now emerging as a result of these meetings. Great. We have plans with Birthrights to organise a meeting, a one-day awareness meeting on advice on consent during pregnancy and labour. I believe this to be absolutely fundamental. We have research projects that are already happening. We want to create what we call the MASIC map, so a mother can dial in their postcode and find out where they go if they've got a problem, because they have no idea at the moment. And we're collecting mother stories with a group from Oxford University to advance our case in the political arena. And we also plan to have a National Education Day about obstetric-related fistulas in the United Kingdom, reminding people that it's not just an African phenomenon. So this is the cost of treating a mother with these injuries. So it's worth, isn't it, trying to prevent them? But we want to assess the cost to society of mothers with these injuries as a result of loss of employment and so forth. And that is some research work that we intend to undertake. So I'd like to thank you for your attention. It's a common problem after childbirth. It is an unspoken taboo, and this specific syndrome needs our support. Thank you for your attention.